Hello, I'm Jonathan Myers from the Glaucoma Service at Wills Eye Hospital. I'd like to tell you a little bit about tube shunt surgery for glaucoma. So as you know, in glaucoma, the pressure is higher than is safe for the optic nerve. And so in some patients with glaucoma, medications and laser treatments are not adequate to control the pressure to a level that is safe for the optic nerve. For some of these patients, incisional surgery may be necessary to control the pressure. One of the more common incisional surgeries for glaucoma is something called a tube shunt. So as the name implies, the tube shunt involves a small, soft silicone tube that drains the fluid from usually the front part of the eye, but sometimes the back, out of the eye, behind the eye. And that's why it's called a tube shunt. It shunts the fluid away from the eye. Sometimes these devices are called stents. There are many types of tubes that are put in the eye to lower pressure, and when we refer to tube shunts, we're talking about devices that are different from trabecular micro-bypass stents, such as the eye stent, or from the express shunt. Those are smaller shunts placed in the front of the eye. The tube shunts have a longer tube that drains the fluid behind the eye. This is done in the operating room in a surgery that usually takes less than an hour. This is not a painful surgery, and in fact, the first week after surgery, most patients don't feel anything worse other than a little tenderness or a little bit of a sense that there's something in the eye. I find that most of my patients don't feel the need to take Tylenol even after the first day. If you do have tube shunt surgery, you should be reassured that most patients with tube shunt surgery achieve good pressure control for many years. If tube shunts fail, often the pressure can be controlled with eye drops. If the eye drops are not controlling it, additional surgery can be done. In fact, some people go on to have a second tube shunt 5, 10, or even 20 years after the first. Tube shunt surgery can have complications such as infection and bleeding, and for that reason, most patients are on antibiotics starting before surgery and lasting for a week or two after surgery. The risk of bleeding, which can cause loss of vision or pain, can be minimized by reducing your activity after surgery, being especially careful not to do any bending, lifting, or anything that feels strenuous. The other complication of tube shunts that I'll mention in this brief video is that a small percentage of patients may experience double vision after their tube shunt. Thankfully, for many patients, this resolves with time as the scar tissue softens and the eye begins to move normally again. For most patients, this isn't a major issue, and in the worst case scenario, it usually can be fixed by removing the tube shunt. However, the vast majority of patients with tube shunt surgery do not have any of these complications, and most patients who have tube shunt surgery have good pressure control for many years. It's been a pleasure to talk with you a little bit about tube shunt surgery for the control of pressure in glaucoma. Thanks.